So when it comes to like injuries that you've seen in the past working with fighters, what are the most common themed injuries?
So I'd say definitely from an MMA perspective or UFC perspective, the most common thing that walks in the door or gives me a call or a text message is definitely the knee injuries. Yeah, for sure. Especially like with the grappling, the twisting, you know, and obviously people know heel hooks and leg locks can obviously damage your knee. But if you're doing a lot of grappling, a lot of wrestling, rolling around, that can sometimes unfortunately cause knee injuries like meniscus tears, ACL tears like yourself, or other ligament tears. Literally last week, pro MMA guy, LCL tear, had to repair that, scope the knee first, and I know you know him.
Yeah. So what do you think can be done? I know you can't fully prevent it, but reduce the risk of that injury occurring.
So I would say being very, well, I guess it's a different mentality. I mean, you know, when I did jiu-jitsu, you know, I'm not a pro fighter, I'm a doctor. So I have very different goals. Yeah. So I want to go in there and I want to, you know, I want a good workout. I want to learn jiu-jitsu, and most importantly, like, I want to have fun, and I want to like be in the community with other guys, like-minded people, whether it's a doctor or a fighter, a lawyer, or whatever. But like when pro MMA guys go, I mean, when you watch those practices, I mean, it's like a complete sprint all the time, and there's big egos involved. Like, you're not going to tap to this guy. Like, I got no problem tapping in practice. I don't care. You know, I'm not a tough guy. But that mentality, and you know, I guess just being careful the way your knees bend and things. If you're in a gi, for example, if it gets stuck in a gi, you notice your finger gets stuck in your knees. It's a good time to take a break and be like, stop, my knees rolled up. That's when you're more at risk of an injury.
Yeah, I mean,
intensity, just the intensity. Like, if you're like super intense, you're fighting a takedown, like, and you're hopping on your knee, that's when you're going to see the ACLs blow.
Yeah, no, I get it. And when I was fighting, like, we actually took the jiu-jitsu and like, I barely got in the gi when I was fighting. But if we did ever do gi, that would be a day that would be like our active recovery day, in a sense, right? And a lot of the fighters can understand that, you know, so I think I understand from that perspective. But what do you think about, like, as far as strengthening up tissue, right? So like, let's say, obviously I'm a strength coach, right? So I'm gonna strengthen up the surrounding tissue that crosses the joint to allow for more stability, more range of motion. That's where I see, and I'm not gonna claim or like, you know, defending what I'm doing for the sport. But I think that's where we come into play more so than anything else as far as performance goes. Would you agree with that?
I would, and I think a lot of, and obviously there's strength involved in that, and strengthening muscles, but I think what gets kind of lost sometimes is how important flexibility is. I think a lot of like hamstring tears or a lot of calf tears and things are people that have lost some flexibility or not too flexible to begin with. You kind of see these two sometimes varying body types. Like, you got the short, stout or muscle guys, probably like, you know, kind of like you, and then you got the very lean, skinny guys. Like, this camp is going to be very flexible, but they're probably going to have issues with strength stuff, right? They'll have their own issues. This side is going to have strength. They're going to be very strong, but they're not going to be very flexible. They're going to have their own different issues. So that's when I see patients in the office, you can kind of identify the body type and let them know what they need to work on for that.
Yeah,